So we move on to the next topic by Dr. Shivani Pattnaik, the story of trailing haptic, tips and tricks to guide the haptic into capsular bag. I think it's a quite common problem with all of us.
Trailing haptic in its journey to follow the leading haptic, which almost always enters the capsular bag easily. Let's see a few routinely used IOLs we have: the single piece, the 3-piece design, Rayner design, and the closed haptic lucidus design. To perfectly guide the trailing haptic into the bag, we need proper instrumentation. A Sinskey hook slips at the optic haptic junction multiple times because of lack of proper grip and support. Oops. Whereas a T-hook perfectly engages the optic haptic junction and dials the IOL into the bag. Notice that the optic and the leading haptic are already in the bag under the CCC margin. There is a 2-directional force required, one downward and the other rotational movement to guide the single piece IOL into the bag. This is a 3-piece IOL being inserted directly through a widened main incision with a McPherson forceps. We may use a secondary instrument to stabilize the optic at this point. A T-hook is now used to engage the optic haptic junction and then dial the IOL downwards and rotate it into the bag. This is a closed haptic design IOL. Note that an iris repositor is used as a side instrument to guide the unfolding trailing haptic into the bag while the injector is still releasing it into the AC. In an alternative approach, after injecting this IOL into the bag, an iris repositor in the non-dominant hand is used to guide the trailing haptic by sliding the IOL downward and to the opposite side simultaneously to place the entire trailing haptic in the bag. This is a 3-piece IOL being injected into the bag. Note that the optic and the leading haptic are already in the bag. The T-hook now engages at the optic haptic junction and guides the IOL downward, and the IOL is finally rotated into the bag. Here the IOL is injected under irrigation and the aspiration cannula is used to direct the optic haptic junction downward and into the bag. This technique reduces the need for visco removal after IOL injection.
Thank you, everyone. There are some times when the trailing haptic remains in the sulcus if the technique of inserting it into the bag is not correct, if we just push it down. So correct forces to be used to rotate the trailing haptic into the bag.
So with this T-dialer, you can have 2 directional force,
yes,
downwards and
downwards and
sidewards
rotational,
also.
yes.
That makes the life much easier, I think. It's okay, it's very clear, I think.
Thank you.
Thank you.
Thank you.